Good evening, Dr. Grice. My name is Heather Norton, and I am taking a moment to respond to your question regarding informed consent and what I might possibly change on the forms that I reviewed for this assignment. And I believe what the first thing that I would change is I would want to see, I would actually prefer to have more information on the consent form regarding the goals, techniques, procedures, the benefits of services, as well as the methodologies and or tools that are used by the counselors. So I feel as though the counselors of Two Trees Counseling did a really good job in outlining the overall idea of what counseling is and the risks and limitations therein. They do discuss in detail about the process of therapy and about how therapy is often can often feel slow in the beginning, and that at times clients feel worse before they start to feel better. And they go on to talk a little bit more about the risks throughout the therapeutic process. I think they did a great thing there. I just would have liked to have seen a little bit more information regarding the benefits of the counseling and working with them. I also would have liked to have known the methodologies that they use, as well as some of the tools that they might use. Do they, in terms of, do they use anything in particular, such as EMDR? Do they, or are they are there any special things that they use, tools or assessment wise, that would be beneficial for me as a future client to know? So I think that was by and large the biggest thing that I would like to see added to their consent form. The other thing that I did see was a lack of acknowledgement on diagnosing, and I think that based on the ethics, the ACA ethics of informed consent, and what I found in the Alabama codes of informed consent, both of those recommend that a discussion be had with the prospective client about diagnosing and an understanding of, or an explanation, of what the DSM is and how diagnosing would actually take place. And there was no mention of that there. And in a journal article that I read from authors Kress, Hoffman, Adamson, and Erickson from 2013, they clearly state in that journal article that providing information about DSM diagnosis and being transparent about what the diagnostic process would look like, that those things can actually help establish a positive foundation for counseling before counseling begins. So thank you so much for listening, and let me know if you have any further questions. Good night.